Hi, my name is Selena Lewis. I'm the clinical instructor on Fort East and BMT. We are the hematology oncology unit as well as the stem cell transplant. Today we're going to be talking about chemo safety for you and for patients and family as well. Hence the name of the presentation, Care of the Patient Receiving Hazardous Drugs. Today our objectives are to list the recommended personal protective equipment needed when caring for a client receiving a hazardous agent or chemotherapy, and describe the cytotoxic spill cleanup process, meaning what you would do as an individual if you were the one that found a spill. Statement of purpose. It is the policy of University Medical Center that healthcare personnel, the patient, and the environment will be protected from unnecessary exposure to potentially hazardous substances. The safe handling and disposal of chemotherapeutic agents is important in order to prevent accidental exposure and spills of those agents. Note, all chemotherapeutic agents are administered by chemotherapy-trained RNs. Now, any nurse can give a hazardous agent, but only RNs can give chemotherapy and hang it. LVNs can monitor. Spill cleanup is performed by specifically trained personnel. That would be environmental services, also known as housekeeping. They have been trained and know what to do if we find a spill. Hazardous drugs are those drugs that exhibit one or more of the following characteristics: carcinogenicity, teratogenicity, reproductive toxicity, organ toxicity, genotoxicity, or any drug similar in structure or toxicity to drugs classified as hazardous. Adverse health effects of occupational exposure to hazardous drugs. Some people that come into contact with hazardous drugs or chemotherapies experience skin irritation, contact dermatitis, mouth and nasal sores, partial alopecia, or hair thinning. Some neurologic changes that they may experience are headaches and dizziness. Respiratory, they would have dyspnea, meaning shortness of breath, GI problems, nausea and vomiting, and abdominal pain. And this doesn't mean if it's a one-time occurrence. It's somebody that's exposed over a long period of time. The one-time occurrence I would think would happen more with skin irritation or contact dermatitis. As a nursing assistant, your risk for exposure is low. On this diagram here, your exposure may happen with handling patient excreta and linens. Therefore, you have to use your chemo PPE that we have available for you. The use of personal protective equipment, PPE, reduces the risk of absorption. PPE would be your blue gloves and blue chemo gowns that will be located on your unit and should be readily available in the patient's room if they are on treatment. Types of exposure one may experience would be injection, accidental needle sticks. That would likely happen in a pharmacy when they're drawing up the medication to mix it. Ingestion, inhalation, absorption through skin, eyes, or mucous membranes. Surface contamination has been found in every single study that has tested for it, meaning the patient's rooms, the medication rooms. In the patient room, it could be the bed rails, it could be the handles to the faucets, the toilet, wherever the patients come into contact with. Unprotected skin easily can become contaminated if surfaces are contaminated. If you do experience exposure, immediately refer to your MSDS, which is located on the UMC intranet homepage. Controls to exposure. This means what we can do as individuals to protect ourselves from exposure to hazardous agents or chemotherapy. This is a busy slide, but what you should really focus on is highlighted in red. Use your personal controls, personal protective equipment known as PPE, again, your blue gloves and blue gown. Administrative controls, that is our job as your leadership. We provide clear policies and procedures, education, training, and evaluation. So when should PPE be used? Of course, when priming IV tubing, which you all will never have to do, that's a pharmacy responsibility. handling leakage from tubing, syringe, and connection sites. Lord willing, you won't ever have to do that. That would be the nurse's responsibility. Disposing of hazardous drugs and items contaminated by hazardous drugs. Cleaning hazardous drug spills. That would be environmental services, also known as EVS, or housekeeping. Handling bodily fluids of patients who have received hazardous drugs in the past 48 hours. Now let's expand on that 48-hour window again. Hazardous drugs are found in urine, feces, sweat, vomitous breast milk, and seminal fluid. Consider all bodily fluids as contaminated for at least 48 hours after completion of drug administration. Studies have been done that shows that chemotherapy and hazardous agents have been found in the urine up to 36 hours of being given. So just the 48 hours is very important to remember that. Cover toilets without a lid before flushing. Now, I don't know of any toilets in our hospital that have lids, so take measures to protect yourself. You can put chucks over the toilet to keep it from spraying up. Our toilets are very forceful when they flush, so there's always some residual that backsplashes. You can put a towel over it. We do have goggles available if it's something that you would like to pursue. That is an option for you. Protect the skin of incontinent patients. Be sure to use skin protectants. Get some from your nurse to put on the patients. Just be an advocate for the patient. If it's somebody that's incontinent, you definitely want to protect their skin. Diapers can be contaminated too, in both children and adults. Wear your PPE when emptying Foley catheters, urinals, and etc. Prevent exposure. Use plastic-backed disposable pads under incontinent patients. Use vinyl plastic pillow covers. Our pillow covers are not plastic, but the pillows are vinyl. So you can just always take the linen out of the room in a yellow bag. If linen becomes contaminated with any bodily fluid within the 48-hour post-administration period, put on your PPE. Bag is contaminated. Right now the policy says to double bag. It is being revised to say yellow bag. Place it in a yellow bag, and those yellow bags are sent downstairs to be incinerated. Gloves should be changed regularly or immediately if torn or punctured. And of course, immediately wash your hands upon removal of the gloves. Spill management. You need to know what to do in case you walk into a patient's room and you see the medication has spilled everywhere. Of course, we want to prevent spills as much as possible. Be prepared though if one does happen. Know where your spill kit is. Here on 4 East, it is in our medication room. If it's on another unit, then it's likely that they will have the chemotherapy cart, and it should be in your cart. Immediately notify the nurse. Do not handle the medication. Post signs where spill is located. Evacuate the area. Notify EVS. Again, EVS have been specially trained to clean and contain the spills. Spills must be cleaned immediately by trained personnel. So what I'd like for you guys to do, if you found a spill, just get everyone out, except the patient, of course, and try to contain the area. Accidental cytotoxic exposure and what to do. First thing you would do is refer to your MSDS, which again is located on the UMC intranet homepage. There are some simple steps you can do. If your skin is exposed, remove the contaminated garment. Immediately wash skin with soap and water. If your eyes are exposed, immediately flush your eyes, so know where your eye wash station is on your unit. Seek emergency treatment. Inhalation, move away from the area of exposure. Seek emergency treatment. Ingestion, do not induce vomiting unless indicated by MSDS. So it's always important that you look at your MSDS first, because each medication has a different way it should be handled. Pregnancy. If all procedures for safe administration and handling of cytotoxic agents are followed, the potential for exposure will be minimized. However, the decision to administer and handle chemotherapy is an individual decision made between the employees and their physicians. So UMC's policy does give a nurse the right to be reassigned if she is pregnant or trying to conceive. Males as well, if they are trying to conceive, they do have the option to be reassigned. This is a sign that we place in patients' rooms over the glove boxes if they're on treatment or if they've been on treatment within that 48-hour window, so that everyone that comes into contact or enters the room knows that they need to place the blue gloves on. We do make the gloves available in the room. This would be transport, dietary, respiratory, or whoever, patients as well, patients and family, they need to put the blue gloves on. So be on the lookout for this sign. Now this is a sign that we use on the outside of the room. And so everything that I have told you in this presentation is on this one little sign. So if there's something that you can't remember about PPEs, safe handling, just read the sign. It does take a minute because it is quite lengthy, but there should be some direction on there for you. Notify your charge nurse, whatever we need to do to help you protect yourself. And that's all I have. The reason we decided to incorporate care of the patients while they're on treatment into nursing assistant orientation is because we were seeing a lot of our cancer patients being admitted on other units when we're full, so they were encountering all different types of patients. So we just wanted everyone to be safe, and we want you to be safe. That's all I have again. So welcome to UMC, and we look forward to having you.